Good morning, everybody. Is everybody able to hear me okay?
Yes, I can hear you.
All right. So if you see me kind of looking to the left or right, I have a couple of screens that I'm looking at to just make sure that I'm on the right page. So like just like Miss Jenny mentioned, if you have I kind of add some little interactions in just to you can talk as much as you want or as less as you would like. I'm okay with that. So to get started, family caregiver essentials, caring hands, loving hearts. So, building confidence, strengthening skills, and promoting safe, supportive care at home for those that you love. So, she told you a little bit about me. And so I have been a nurse for a long time, for it's pretty much over 30 years. And I took care of my mom. So I am coming from a place of understanding and knowing what you are going through and actually, what you're doing. And I want to let you know from the start, you are great, you are wonderful, and what you're doing is awesome. Okay. So my goals for this presentation is to equip family members with practical, easy to use skills that they can apply immediately. Increase your confidence, knowledge, and decision-making abilities. Reduce caregiver stress by providing clear guidance and realistic expectations. Promote dignity, safety, and quality of life for older adults receiving care. Encourage caregivers to recognize their own needs and practice self-care without guilt. And empower caregivers to become informed partners in the health in your with the healthcare team. So let's take a look at your caregiving journey. Let's begin together. Caregiving is not something that most of us planned for. So let's take a moment to just look at where your caregiving journey is without judgment. Where is your caregiving journey? So today we'll build the skills and confidence that you need to provide compassionate, effective care while taking care of yourself, which is definitely important. So, understanding your role as a caregiver, and of course, this is not the total list, but just some things that to understand about your role. You schedule, make appointments, you coordinate with healthcare providers, and you keep track of those important dates and those medical visits. You provide emotional support. You provide companionship, emotional support, maintaining dignity throughout the caregiver relationship. Medication support. You ensure medications are taken correctly, tracking refills, and monitoring for side effects or interactions. And you're an advocate for the ones that you care for, speaking up for your loved ones' needs, for their preferences, and for their rights in healthcare and daily life situations. So let's do some reflection on your story. As I mentioned, you can talk as much or as little as you would like. So, just anybody, if you just want to share, what brought you into the caregiver role? What is the hardest part at this time? And what is one thing you hope to leave this session with today? Would anybody like to share?
You can either unmute or
Okay.
add into the chat.
Mhm. Miss Crystal, I'm listening.
Well,
Oh, okay.
what, excuse me, what brought me was, being a spouse, marriage person, and my wife
Hmm.
got sick. So that's what brought me.
Okay. Okay. Anybody else would like to add any what they would like to leave this session with? I think kind of the hardest part of what you're doing right now. And like I mentioned, no judgment. Okay, so what may have brought some of you, like for me, it was understanding that my mom had Alzheimer's and she needed me to assist her, to help her. I'm the oldest, and usually when you're the oldest in the family, you're expected to be that person that kind of steps up. So that's what brought me and understanding and knowing that I wanted to make sure that my mom was taken care of. Okay. So these questions, and you can kind of think about these questions, just for yourself. These questions will help you understand your motivations, the challenges, the goals, and how you want to navigate through this journey of taking care of the ones that you love. Essential truths about caregiving. Caregiving is love and overwhelming. It can coexist, meaning you can love that person you're taking care of, but you also can feel overwhelmed at times. Both of these are valid feelings and they are normal. And asking for help. If you ask for help, it does not mean that you are failing. It just means that you're realistic and you are being responsible. So, understanding that being overwhelmed, because I got overwhelmed at times, being overwhelmed is okay. It is okay to feel overwhelmed, but you can also love the person that you're taking care of. And don't forget, ask for help. It doesn't mean that you're failing or that you're not doing a good job. It just means that you're living in a realistic aspect of what you're doing. Foundations of caregiving. So understand that the physical and cognitive changes that come with aging and illness helps us to provide better, more compassionate care. So we're going to go into what the things that happen as you're the ones you're taking care of age and also as we age as well. So the impact of aging and illness. You may notice physical changes, such as decreased strength and endurance. And these decreased strength and endurance coming from a nursing or clinical aspect can be due to things like arthritis. That's probably one of the biggest things. It's like if your loved one has arthritis, they're going to feel they have decreased strength. They may not be able to walk as far as they usually would. Balance and coordination changes. This also can come with things like arthritis, rheumatoid arthritis, osteoarthritis. Reduced stamina and energy levels, and changes in mobility and flexibility. So these are the physical challenges physical changes that you may see as someone ages. And then the cognitive changes. Memory difficulties. We all forget things. So we have to kind of measure and say, okay, is this person forgetting things because this is just the normal of forgetting, no matter what age you are? Or are there other things that may be happening that my loved one may be experiencing as far as memory difficulties? Processing speed variations or decision-making challenges. So one of the first things when you're recognizing things like dementia or Alzheimer's is they always say financial. The financial is what usually is where most people start to recognize that there have been changes. Maybe a loved one does not, forgets to pay their bills, or when it comes to, God forbid, driving, and you notice that the loved one, they forgot how to get home. So those are changes that you watch for, and that sometimes most of the time you have to be realistic about. Activities of daily living. So bathing, supporting hygiene while maintaining privacy and dignity. Dressing, helping with clothing choices and physical assistance as needed. Grooming, supporting personal care and appearance maintenance. And mobility, assistance with movement and transfer safely. Focusing on preserving dignity and independence in all activities of daily living. So these things are things that you don't want to, per se take over and do for them, but let your the person you're caring for just do as much as they possibly can so they can continue to feel independent with their activities of daily living. So let's kind of look at one thing that may happen in a scenario. Your loved one can still bathe themselves, but slowly and becoming frustrated when rushed. You often want to step in and help, but it leads to arguments. So some things are like, what might your loved one be experiencing? How could the least assistive approach change this interaction? And what would verbal or visual cueing or prompting them look like here? Anybody want to jump in and kind of about this? So maybe your loved one is experiencing, they want to make sure that they want to stay as independent as possible. Okay. And the least assistive approach would be, just standing by, just making sure that they're safe. Okay. So this is the least assistive approach. Independence, verbal cues, visual cues, and physical assistance. Always start with the least amount of help and only increase assistance as they truly need it. This preserves their independence and their dignity. So, how much help is help? How much is helping too much? How much help is too much help? Where might I be helping too much or too quickly because I'm anxious or pressed for time? Sometimes when those overwhelming feelings come in, you may feel you yourself as a caregiver feel anxious. So if you feel anxious, then the person you're caring for may feel anxious. So they may feel like them maybe being slower on doing things, keeping their independence, maybe making you anxious. So independence may look slower, but it is still independence. And preserving dignity often matters more than efficiency. So helping that person that you're caring for, your spouse, your brother, your sister, whoever it is you're taking care of, preserving their dignity means, taking things a little slower. And you want efficient, it doesn't matter if it's done efficient. What it matters is preserving their dignities and preserving their independence. Creating a safe home environment. So, a safe home environment prevents falls and injuries, which allows your loved ones to maintain independence and confidence. So, some of the fall prevention essentials are lighting, such as ensuring adequate lighting in all rooms and hallways and stairways, and using night lights in bedrooms and baths. And these are for the loved ones that, may be still, ambulatory or may still walk around, and just making sure that everything is well lit. Removing hazards, securing or removing loose rugs, clearing clutter from walkways, or organizing cords safely. Safe footwear, encouraging non-slip shoes or slippers with good support, and avoid loose or backless software. So those socks that, provide if there's, if they're still ambulatory, your loved ones that are ambulatory, having those socks with those skid proof, helping them to also, that helps them to maintain their independence as well, but actually, and also safety. Grab bars and rails. Install grab bars in bathrooms and handrails on stairs for additional support. So, recognizing the warning signs, a family member notices her loved one has been more tired and confused than usual, but assumes it's just a bad day. What early warning signs should raise concern? How can family members trust their instincts when panicking? And who should be contacted first when something feels off? So those early warning signs are things like what I mentioned earlier, things like when they're driving home, or and they forget where they are, or forgetting to pay their bills, or sometimes it can come out in behaviors such as anger, or just feeling just more confused about where they are. Trust your instincts. You know your family members, you know your loved ones. Trust your instincts. And the first person you should contact should be your practitioner. Of course, if you have other family members, talk to them as well, but you want to contact, your practitioner, the your loved one's physician to just, let them know what's going on. Trusting your instincts mean early action prevents emergencies. Addressing those small changes early often prevents larger crises later. Don't wait for a dramatic event. You're the expert. Family caregivers are often the first and most accurate observers of changes in their loved one's conditions. Think about a time when you noticed a small change. What did you do and what might you do differently? This is just some things just to think about. But just understand that you are the expert. You're the person that knows your loved ones the most. And, it can be a small change. Don't wait until it's something that is really big that contact your physician. Those small things can be ways of preventing those bigger crises from happening, or those bigger emergencies from happening. Medication awareness. Understanding medications is a safety issue. It's not a knowledge test. There are no silly questions when it comes to medications. So, what do you need to know? The name and purpose of each medication, the correct dosage and timing, common side effects to watch for, potential drug interactions, storage requirements, and what to do if a dose is missed. So this is just a little case study here about medication confusion. It says a husband manages his wife's medications, but unsure which medications are for what condition. He feels embarrassed about asking questions at appointments. What risks exist when caregivers don't fully understand medications? How can caregivers advocate confidently with providers? And what tools can make medication management easier? So, being a nurse, giving medications and understanding medications, when you don't understand what your loved one's medications are given for, it can sometimes be confusing for you as well. So just make sure that there are risks for not understanding what your loved one is getting medications for. Advocate when you go into a provider. I know sometimes physicians are very they have a certain amount of time they want to come in and see your loved one. No, you ask questions. Have those questions already written down. Ask the providers what you need to know and accept and make sure that you understand before that provider leaves that room. So those are going to be the things that's going to make that medication management a little easier for you. Advocate with healthcare providers. Your right to understand. Healthcare providers expect questions. It's part of their job. So ask questions. Asking questions protects your loved ones and it demonstrates a responsible caregiving. So helpful phrases are such things as, can you explain what this medication does? What should I watch for? Can you write that down for me? And what happens if we miss a dose? So these are things that you can go over with your caregiver. These are things, with your physician. Just make sure that you understand because medication is so important, especially if they're taking medications for chronic diseases such as diabetes, high blood pressure, if they're taking medication for things like dementia, Alzheimer's, to control any kind of behaviors that your loved one may be having. Ask those questions. That is so very important. So, reflection. Do I feel comfortable asking questions or do I worry about being judged? Do not worry about being judged. I work in an Alzheimer's unit here where I am. And one thing I always tell my family members, ask questions. If I don't know the answer, I'm going to get it for you because they want to know these things and I want them to be comfortable asking me, no judgment. Remember, there are no silly questions when it comes to medications. Understanding medications is a safety issue. It is not a knowledge test. Communication and emotional support. Effective communication builds trust. It reduces your stress. It preserves dignity in the caregiver relationship. So, some core communication skills are patience, empathy, validation, and simple language. So, with patient, allow time for responses. Don't rush conversations or finish sentences. So, remember when I mentioned earlier about, response time. So, like for instance, when you ask if you have a loved one that you're taking care of that has dementia or Alzheimer's, and you may ask them, Mom or Dad, what do you want to eat today? We have chicken and we have a hamburger. Wait on their responses. Which one would you like today? Don't rush those things, so just to give them time because what this does, it preserves dignity and it still gives them independence. Empathy. Try to understand their perspective and feelings, even when behavior is challenging. Understand that if you have a loved one that is in a behavior, understand they may be afraid. They may be confused. They may not understand what's going on. Validation. Acknowledge feelings without dismissing or arguing, such as, I can see this is frustrating. This says you understand what they're going through. You understand that whatever is going on is frustrating for them. And simple language. Use clear, short sentences. Break complex information into smaller pieces. So make sure that when you're asking them something or you are giving them a statement, make sure it is a short sentence that they can understand, especially with if you're taking care of someone that has dementia or Alzheimer's. So here's another case study of an accusation. A mother with memory loss accuses her daughter of stealing when she misplaces items. Which emotion may be driving the behavior? How could arguing escalate the situation? And what dementia-friendly response could reduce stress? So if you have someone who has dementia or Alzheimer's and they accuse a family member, anyone of of stealing, or it could be because they misplaced it, but they don't understand that they misplaced it. And I always say this about when it comes to a person with dementia, Alzheimer's, they don't know what they don't remember. They don't remember what they don't remember. Always remember that is that when it comes to, a person not remembering something, they don't know that they're not remembering it. They're remembering whatever they can remember. That long-term memory is still there, but that short-term memory may is not it's not there per se. Okay. So behavior is communication. This is their way of communicating. Responding to feelings, not facts, often de escalates conflict. When someone with dementia makes an accusation, they're expressing fear or confusion, not stating a fact to debate. So it can be an unmet need such as hunger, pain, fear, confusion. Depending on where the dementia or the Alzheimer's is, to them in their head, they're asking you the right question, but it's not coming out per se through verbal. So it can be hunger, or I'm hurting, or I'm afraid, or I'm just confused. Behavior such as accusation, anger, or withdrawal. Response, address feelings, not fact. So your response style. How do I usually respond when I feel falsely accused or hurt? Understanding our own emotional triggers helps us respond more effectively to challenge behaviors. It's natural to feel hurt, but our response can either escalate or calm the situation. Recognizing dementia and Alzheimer's disease. Early recognition and gentle conversations about memory concerns preserve trust and allow for better planning and support. So, early warning signs, memory loss, forgetting recent conversations, forgetting appointments or events, or asking the same questions repeatedly. Asking the same questions repeatedly is definitely an early warning signs. If you have ever, if you've ever been, if like in your, like if you visit your mom or your dad or someone in your family and they continually ask that question over and over again, that was an early warning sign for me, from my mom. Confusion, getting lost in familiar places, losing track of time, or difficulty following conversations. Those mood changes, such as anxiety, depression, irritability, or personality shifts that seem to be out of character. As I mentioned earlier, you are the expert. You know your loved one, you know what's going on. Trust your instincts. Daily task difficulties, struggling with familiar tasks like cooking, managing finances, or following recipes. So things like leaving the stove on, repeatedly leaving the stove on, not being able to manage their finances or forgetting to pay bills. The delayed conversation. A family delays discussing memory concerns because they don't want to upset their loved ones. So, what are the risks of waiting too long? How can conversations be framed as support rather than criticism? And what words or tone feels the safest? Avoiding conversations doesn't avoid outcomes. Gentle honesty, it preserves and trusts more than silence. Early conversations allow for planning, it allows for assessing resources, and includes your loved ones in decisions while they can still participate. So, some helpful approaches might be using I statements instead of such as I've noticed rather than you always. Express concerns, not criticism, such as I care about you and I want to help. Focus on specific examples such as last week, last week when, last week when you went to the store, I noticed it took you longer to return home. Suggest seeing a doctor together. Let's get checked out together. I'm here for you. Emphasize partnership. We can figure this out together. This lets them know that you're not alone. I'm right here with you. I'm here through this journey. The conversation that you're avoiding. What conversations have you been avoiding and why? Identifying what holds us back, fear, guilt, or uncertainty, is the first step toward having the conversations that matter the most. Preparing for emergencies. Preparedness is an act of love, it's not fear. Planning ahead protects both the caregiver and the loved one when stress reduces decision-making ability. So, some emergency planning essentials: a hospital bag. Keep a bag ready with medications, with insurance cards, with medical history, and comfort items. Important documents: organize advance directives, power of attorneys, insurance information, and contact lists. Transportation plan: know who I can call and know how to get to the hospital quickly in an emergency. And this is if for some reason, I know sometimes like if people live in rural areas, it may be long before you get to the hospital. You may have to take your loved one if it's something that is not an emergent thing, but you may have to, take your loved one, or just understanding how long it takes to get to where you're trying to get to the hospital. And contact lists. Keep updated emergency contacts, including doctors, family members, and neighbors. Planning for emergencies is very important. So if you do have an emergency, it does not stress you at that point. So are you prepared? Ask yourself, do you have a hospital bag ready? If an emergency happened tonight, what would be hardest? Do you know where all important documents are located? Have you discussed emergency preparedness with your loved ones? And does someone else know your emergency plan? Don't try to take this on yourself. If you have siblings, if you have someone that can assist you, always let them know your emergency plan as well. Caregiver self-care. This is so important. Caregiver health directly affects care quality. Caring for yourself is caring for your loved ones. So, the guilty caregiver. A caregiver skips her own doctor's appointments and feels guilty resting. What signs of burnout stood out to you? Why do caregivers often feel guilty about self-care? What would putting your oxygen mask on first look like in a real life? This brings you to, when you get on an airplane and the first thing they tell you, if there's an emergency, put your mask on first and then assist the person next to you or assist someone else. So, saying this, take care of yourself so that you're able to take care of the person that you are caring for. So, how do you recognize burnout? Physical signs are chronic fatigue. You can't sleep. You're having sleep issues, sleep problems, frequent illness, and changes in appetite or weight. Emotional signs. You're irritable. You're anxious. You may become depressed, feeling overwhelmed, or a feeling of hopelessness. Behavioral signs, withdrawing from friends, neglecting your own health, and increased use of alcohol or medications. And cognitive signs, difficulty concentrating, memory problems, or inability to make decisions. Burnout is not a sign of a weakness, it's a warning. Recognizing these signs early, it will allow you to take action before you reach a crisis. Self-care is not selfish. Small actions matter. Self-care doesn't require hours. A 10-minute walk, a phone call with a friend, or a quiet cup of coffee can restore energy. Set boundaries. It's okay to say no. It's okay to ask for help. It's okay to take a break. These aren't failures. These are necessities. Maintain your health. Keep your own medical appointments. Take your medications. Get adequate sleep. You can't pour from an empty cup. So your self-care commitment, and I would like just to say, just take some time to do this. What is one small boundary or self-care action that I can commit to this week? Write it down, share it with someone, make it specific and achievable. Remember, caring for yourself is caring for your loved one. Community resources and support. Aging services. Local area agency on aging offers resources and support groups and respite care options. Faith communities. Many religious organizations offer practical support such as meals, transportation, and emotional care. And caregiver groups. Connect with others who understand your journey. Share experiences and learn from each other. And healthcare resources. Social workers, patient navigators, and care coordinators can help connect you to services. You don't have to do this alone. Resources exist for the purpose of supporting you. Reaching out is a sign of strength. It's not a sign of weakness. And always remember the work that you do or the caregiving that you do for your loved one. It is a sacred work. So think about what insight or skill will you take with you. One thing you want to try differently, what will you change or implement in your caregiving? One support you need to seek. What help will you ask for, or what resources will you explore? You are doing sacred work. It may feel unseen, but it matters deeply. One thing I would like to let you know is family caregivers are the quiet strength behind every moment of comfort giving. Love, not because it's easy, but because someone they love and care for needs them. Their care is not just what they do, it is who you are. Thank you. Any questions?
Thank you so much for that, Dr. Bygrave. For any of you who do have a question or comment, please feel free to unmute or enter it into the chat and I'll read it out loud. While we're waiting, we do have a comment in the chat. Brenda says, I've been a caregiver for my mom for 5 years now, and she has Alzheimer's disease. And I had burnout about a year and a half ago. My mom was in a memory care facility and was discharged due to no longer being ambulatory. I have her again, and this time it gave me time to really appreciate that she is here with me. She's in her final stage of the disease. She can't walk very well, and I have had to change her and wipe her because she's no longer able to do these tasks. I am blessed that God has given me another chance to care for my mom and give her the love and care that she needs. I'm grateful to care for my mom and know that she is taken care of. Thank you,
Yes.
Brenda. And I see that pattern often, Dr. Bygrave, when you probably can attest to this as well, where it's that kind of in between space of, maybe you don't love all the work that you have to do, but you love the opportunity to show the care that you do have. And so it's that both and that in between, right?
Yes, absolutely. Like I mentioned, love and overwhelm and being overwhelmed, it does coexist. You are going to be overwhelmed. So don't let anybody let you say, oh, it's going to be really easy. It's not easy, but you love that person and you're going to do it because that love is more than being overwhelmed. And I always know it's okay. It doesn't say that you failed. It says that you're human. So, but you've chosen this, but in a sense, it's almost like we don't think it's going to happen, but it's going to happen. And when it does, it's like, hey, I know this is what I'm supposed to be doing. This is part of my journey.
Wonderful. All right, we've got another comment from Brenda. I didn't know before how to love her and show it because I was constantly saying, don't do this, do this. Yeah. Yeah.
And mistakes are okay. You're going to make mistakes. There's no perfect caregiver. There's no perfect way to care. Because when you have things like when you have a loved one that has Alzheimer's or dementia, it's going to be different every day. Like I mentioned, I work in a caregiver. I work in a memory care unit, and it is different every day. When the sundowning happens, it is very different. It's something different every single day. And you live in their reality. You live in their reality. And it can go from behavior to laughter to sadness to sadness. But that is the realities of the disease.
Yes. All right. Oh, okay. Now Brenda says, I strive to hug her and show her so much love and affection that I didn't before. Yeah.
Yeah.
And I think that's the beauty of the journey is that it does evolve, it does progress. You do learn, you do soften in some places where maybe you were harder in other spaces. So that compassion that you give out to your loved one comes back around to you too sometimes.
Absolutely.
All right. All right, well, while you all are collecting your thoughts and your comments, I want to thank Dr. Bygrave again for coming, and I hope this is just the first of many collaborations between Alabama Respite and you. It's always great to have experts on, but especially experts who have lived experience. That combination is that 1-2 punch we love. So thank you so much.
You're welcome.
I'll go ahead and stop the recording now.